Hello, I'm Dr. Ankit Parakh. I'm working as a consultant in Pediatric Pulmonology and Sleep Medicine at BLK Hospital. So basically, I'm a specialist for lung problems and sleep problems for children. So today we'll speak about a very common problem which we face in daily practice, that is childhood asthma. So basically, let's first understand what asthma is. So in asthma, the airways which are there in the child's lung, they become red, they become swollen, they become narrow, and they become very sensitive to irritants. Now when this happens, it leads to a lot of coughing, it leads to a lot of difficulty in breathing. Sometimes we hear a noise in the chest which we call as wheezing. So wheezing is basically a whistling noise which you can see. For example, some sort of this noise which can be heard. And children can have difficulty when they run around and play. Now asthma is something which is very common, but the problem is that it is highly undertreated and under-recognized in children. So what are the common symptoms of asthma which we see in children? Now a child can present in various different forms. So usually we will find children will have episodes of cough which is associated with difficulty in breathing. It is associated with this whistling noise, as I said, called as wheezing. And at these moments the child will have difficulty in breathing. Now these episodes usually are treated with some medicines, they improve, and the child can have multiple of these episodes throughout the year. This is the most common way children with asthma would present. But there would be a lot of children who can present with cough which doesn't improve, cough which is there which worsens with exercise, cough which is present mainly at night, children who have difficulty in playing, difficulty in breathing during playing. So these are the other forms in which asthma in children can present. It can also be associated with nasal problems. A lot of children with asthma, they have associated nasal allergies, and a cold which is not improving is also part of this. So children can have a lot of sneezing, they can have a lot of running nose, blocked nose, difficulty in breathing through the nose. So this is associated with allergic nose, which is a part of the allergy which is there in the body. Now most of these children will get some form of symptomatic treatment in the form of oral medicines, some will get nebulizations, and this keeps on happening. What we don't realize is that once a child has become slightly better, we feel the child has improved and the treatment is stopped. But what actually happens in a child with asthma is that once the acute episode has gone, the swelling in the airways still would remain. So when we feel the child is better, even then the swelling in the airways remain, and this is something which we need to realize. Now because the swelling remains even during periods where the child is feeling slightly better, we need to treat this swelling. So treatment in most of the asthmas has to be long term, it has to be throughout the season, sometimes throughout the year, and that is going to keep a child absolutely well. The child should not be coughing at all, the child should not be having any problems during exercise, in sports, the child should be sleeping absolutely well and should be able to eat anything he wants. So the goals of asthma treatment are, to keep the child 100% physically active, physically fit, with no restrictions on life. And most of the times these goals are not being met. So what do we need to do? So first you need a good diagnosis. So your child specialist or your child pulmonologist should be able to make a good diagnosis, should be able to do a lung function test, which we can now do even in very young children, that can help us decide whether this child has asthma. Next is the treatment part. Now in treatment of asthma, we have to realize that because we need to give medicines regularly for a while, then the medicines have to be in a very small quantity which are going to improve the swelling in the lung, but at the same time is not going to harm the body. So usually we would like to give medicines through a system known as inhalers. So inhalers are a form of treatment where the same medicines which we are giving through an oral route or nebulized route actually goes in a very small quantity to the lungs and does not lead to any possible side effects. So inhalational therapy has to be learned, and your doctor will help you with that. And the important thing is that it has to be taken properly in the correct doses for a correct duration of time. So mostly what happens is that when children are keeping well, parents would stop these medicines and the symptoms would reappear. So the caution here is that you should not stop your medicine when the child is appearing well. They need to be taken for a proper duration of time, and only with the advice of your pediatrician or your pulmonologist you should decrease the amount of medicine, and when they decide to take the child off, only then that should be done. Now, what other things can help? So the other things which would help is to avoid things which can trigger asthma. So these things could be smoke, they could be cigarette smoking in the house, they could be things like talcum, deodorant, perfumes which are irritants. We should avoid using coils, mosquito repellents at home. They can be a big source of irritation to the airways and can worsen asthma. We also need to avoid things like a lot of dust, because dust mites are a major trigger for your asthma. So children should be kept in a clean environment. Soft toys should be removed. The carpets and the upholstery should be regularly vacuumed. If you have a pet in the house, then you should make sure that the pet is bathed weekly and the pet is kept outside the room where the child actually sleeps. So these are the usual measures which will help to reduce the load of the allergens and the irritants and keep your child well. So thank you very much. For any more information regarding asthma, please log on to our website.
BLK Super Speciality Hospital, a passion for healing.